Good morning. Today we will be discussing about the thyroid disorders. It comes under the endocrine disorders. So initially we should know that what is an endocrine gland is. So endocrine gland is a ductless gland that secrete hormones directly into the bloodstream. And what is a hormone? It is a chemical substance that is produced in the body to control and regulate the activity to certain cells or organs. And all the hormone productions, we know that it is controlled by the positive feedback or otherwise the negative feedback. So, what are the endocrine glands? Coming under the endocrine glands, you have the pituitary gland, the thyroid gland, the parathyroid gland, the adrenal gland, the glands producing the sex hormones, as well as pancreas. And here we are dealing with the thyroid gland disorders. So, what are the thyroid gland hormones? That is the hormones produced by the thyroid gland, which is again an endocrine gland. So, first and the major thing is triiodothyronine, that is the T3. Tetraiodothyronine, that is T4. And the third one is thyrocalcitonin. So all the disorders of the thyroid gland can be classified as hypothyroidism as well as hyperthyroidism. So when you have the thyroid production is less, then we call it as in hypothyroidism. And when the thyroid hormones are more, we call it as hyperthyroidism. So coming to hypothyroidism, the etiology it could be an autoimmune disorders, it may be or inflammation in the thyroid gland, that is thyroiditis or choroid goiter, any irradiations or surgical removal of the whole gland or iodine deficiency. So mainly, whenever you have hypothyroidism in children, it is referred to as cretinism. And when you see hypothyroidism in adults, it is referred to as myxedema. So coming to the oral manifestations, in cretinism, we can see children will have small jaws, shallow dental arch, as well as retruded chin. There can be even delayed shedding of deciduous teeth, as well as there can be even delayed eruption of permanent teeth. So all these findings can lead us into malocclusion. And there can be an enlarged tongue. In these pictures, both these pictures, we can appreciate that the children have an open bite and there can be drooling of saliva too. So coming to myxedema, it is that is hypothyroidism in adults. The clinical features most commonly seen is fatigueness, weight gain, constipation. There can be bradycardia as well as slow reflexes, hypothermia, cardiac failure, pericardial effusion, hypoventilation, hypoglycemia, hyponatremia. That is the sodium level of the serum sodium level will be low, and you have a peculiar condition in this myxedema, that is the referred to as the myxedema madness, where you have dementia, psychosis, as well as delusion. When all this comes, we refer the condition to as myxedema madness. Coming to oral manifestation of myxedema, that is most commonly seen as macroglossia as well as hoarseness of voice. And there can be compromised periodontal health, delayed wound healing, and also delayed tooth eruption. Salivary enlargement, gland enlargement can also be seen, which can lead into xerostomia later, taste changes, or even burning sensation in the oral cavity, as referred to as the burning mouth symptoms. So here in this picture, we can see whenever you have a hyperfunctioning thyroid, there can be an enlargement of the thyroid gland. And here in picture C, the most prominent feature being the proptosis. That is the protrusion of the eyeball. So here we should do an investigation of the TSH level. If it is more than 0.05 μl per liter, then we can say that the patient is going for hypothyroidism. And here the free T4 as well as the T3 level will be elevated. And the antibodies like thyroglobulin, TSI, TSHR, and TBIA can also be checked. So what is the treatment for this? So the medically we can give the treatment for hyperthyroidism as carbimazole 40 to 60 milligrams for 3 weeks, propylthiouracil as well as propanol 160 milligram per day. Surgical option is also there, and you can even go for radioiodine therapy. So we should always know what is thyroid crisis or the thyroid storm. It is a very rare as well as a life-threatening condition referred to as thyroid toxicosis. That is the transient increase in the serum thyroid hormone, which can be precipitated by the stress or infection. Also, it is seen following thyroidectomy or radioiodine therapy. And the features of this thyroid storm is rapid deterioration, hyperpyrexia, severe tachycardia, restlessness, cardiac failure, as well as liver dysfunction. And the treatment given to prevent thyroid crisis, we can give medications like propanol, potassium iodide, antithyroid drugs, as well as corticosteroids. So here, what we are concerned mainly both about hypothyroidism as well as hyperthyroidism is the dental considerations that should be done or the dental treatment modifications that should be done when a patient with a thyroid disorder comes to a clinic or in a hospital. So in a well-controlled case, that is, the patient's hormone levels are very much controlled, and because patient is taking the medications, then actually there is no risk. We can almost do all the procedures for the patient. But if it is a poorly controlled hormone level, then we should always send to the physician for a consult or consultation, and the patient has to report with that following consent. And if the patient has a history of thyroid cancer or has undergone surgery or radioiodine therapy also, you should go for a physician consent. Hashimoto's thyroiditis. Here, we know when a person has a autoimmune disorder, patient might also have other autoimmune disorders, like, for example, Sjogren's syndrome. And if we are suspicious that patient is having a wet mouth or a dry eyes, we should also check for other autoimmune diseases in the patient. In case of hypothyroidism, what is the dental considerations we should think of is, if it's a well-controlled patient, again, there is no problem at all. You can give the local anesthetics with epinephrine. And if it is an uncontrolled hypothyroidism, that is the hormone levels are out of control, then we should think about respiratory depression. So it is always right to place the patient in a semi-upright position. And in case of any oxygen deficiency, we should give oxygen supplementation and always limit the use of narcotic analgesics. And here we know, since the patient is susceptible to cardiovascular diseases, and if the patient is having atrial fibrillation is already on anticoagulant therapy, coagulation test, prothrombin test as well as partial prothrombin test and INR test should be always done before proceeding into the treatment procedures. And we should always expect delayed wound healing in case of hypothyroidism. So a very good follow as well as good hygiene control is very necessary in patients with hypothyroidism. Coming to dental management with in hypothyroidism cases, the patient there is always a chance of patient going into thyroid crisis or which can be precipitated by stress or infection. Therefore, here LA with epinephrine is completely contraindicated. And since again they are also susceptible to cardiovascular diseases, diseases, we should be careful about it. And there can be any drug interactions in such cases, that is, aspirin as well as some NSAIDs is seen to increase the T4 level. So we should avoid the drugs so that agranulocytosis as well as leukopenia can be also seen in infections. Therefore, we should surely avoid any drugs causing leukopenia or agranulocytosis. And propyl thiouracil in as side effect, it is seen to have produced silolithiasis as well as a increased anticoagulation effect. So we should be very careful while treating patients with hypothyroidism as well as hyperthyroidism. So I conclude by saying that we should take all the precautions and the dental modifications while doing a patient with a thyroid disorder. Thank you.